I move to suspend the rules and pass S-198, the Data Mapping to Save Moms Lives Act, as amended.
The clerk will report the title of the bill.
Senate 198, an act to require the Federal Communications Commission to incorporate data on maternal health outcomes into its broadband health maps.
Pursuant to the rule, the gentleman from New Jersey, Mr. Pallone, and the gentleman from Pennsylvania, Mr. Joyce, each will control 20 minutes. The chair recognizes the gentleman from New Jersey.
And Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous material on S-198.
Without objection.
Mr. Speaker, I rise in strong support of S-198, the Data Mapping to Save Moms Lives Act. The United States has the highest rate of maternal mortality across developed nations. And while maternal mortality and morbidity are problems that affect women throughout the country, these concerns are especially pronounced in Black and Native American communities. Maternal mortality rates for Black women are 3 times higher than those of white women, and the rate of death for American Indians and Alaska Native women is 2 times higher. And this is simply unacceptable, and we should be taking action to reverse these disturbing numbers. Technology, Mr. Speaker, has a role to play, but it requires modern connectivity like high-speed broadband to provide the most potential. For instance, access to telehealth services like routine checkups, health monitoring, and updated prescriptions can go a long way in ensuring the health and safety of both the mother and the child. This legislation before us today seeks to help lawmakers, public health officials, and the public at large to consider issues of connectivity and maternal health outcomes in tandem. And once implemented, it will provide a better idea for how connectivity and health data intersect. And this will help us better target telehealth services to vulnerable populations and communities at risk of maternal mortality and morbidity. Specifically, Mr. Speaker, it will require the FCC to integrate publicly available data related to maternal health, including mortality and severe morbidity, into its Mapping Broadband Health in America platform. The FCC will be required to consult with the Centers for Disease Control and Prevention to determine the right data to include for this effort. And we've worked closely with our Senate colleagues to get this legislation enacted, and I want to acknowledge and thank Senators Rosen and Fisher for their leadership on the bill. This bipartisan Senate bill incorporates the text of the House-passed version championed by Representatives Butterfield, Bilirakis, and Lisa Blunt Rochester. This initiative, Mr. Speaker, combined with other good work that we in the executive branch have done, will help us better understand the communications barriers that some pregnant women face so that we can explore connectivity policies that help keep these women safe and healthy. So, Mr. Speaker, for these reasons, I urge my colleagues to support S-198, the Data Mapping to Save Moms Lives Act, in a bipartisan manner, and I reserve the balance of my time.
The gentleman reserves. The gentleman from Pennsylvania is recognized.
Thank you, Mr. Speaker. I rise today in support of S-198, the Data Mapping to Save Moms Lives Act, that mirrors legislation from Representatives Bilirakis and Butterfield. Their legislation passed by the House by over 400 votes in April of this year. Maternal mortality continues to affect moms and children across the United States. The Energy and Commerce Committee has worked in a bipartisan way to address this preventable issue, but unfortunately, challenges remain. This legislation will build on existing tools of the Federal Communications Commission by incorporating publicly available data on maternal health outcomes into its Mapping Broadband Health in America tool. The FCC would be required to work with the Centers for Disease Control and Prevention to determine what maternal health outcomes to include. I encourage all of my colleagues to support this legislation, and I reserve.
The gentleman reserves. The gentleman from New Jersey is recognized.
Mr. Speaker, I have no additional speakers, so if the gentleman wants to close.
Gentleman reserves.
The gentleman reserves. The gentleman from Pennsylvania is recognized. Is there any water?
I yield to Mr. Carter from Georgia.
I thank the gentleman for yielding. Mr. Speaker, I rise today in support of Senate Bill 198, the Data Mapping to Save Moms Lives Act. Earlier this year, the House passed H.R. 1218, which was introduced by Representatives Butterfield and Bilirakis. This legislation was the result of bipartisan work through hearings and markups in the Energy and Commerce Committee. I'm pleased to see changes to that Republican efforts to improve the legislation are included in the bill before us. Today's legislation amends the Senate bill to include the House-passed language, which I was pleased to support earlier this year. The Data Mapping to Save Moms' Lives Act follows other bipartisan work the Energy and Commerce Committee has done to address maternal mortality in America. I'm pleased to support this legislation, and I urge my colleagues to do so as well. And I yield back.
Gentleman yields back. The gentleman from New Jersey is recognized.
Again, I don't know if my colleague has additional speakers. Okay.
Back.
He yields back.
Gentleman from New
I
Jersey.
would just once again urge that we support this on a bipartisan basis and urge all my colleagues to support it. And with that, I yield back, Mr. Speaker.
Gentleman yields back. The question is, will the House suspend the rules and pass Senate Bill 198? As amended, those in favor say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative. For what purpose does the gentleman from Montana seek recognition?
Thank you, Mr. Speaker. I would request the yeas and nays, please.
The yeas and nays are requested. All those in favor of taking this vote by the yeas and nays will rise and remain standing until counted. A sufficient number having risen, the yeas and nays are ordered pursuant to Clause 8 of Rule 20. Further proceedings on this question will be postponed.